All right, hello everybody. We're going to get started now. So I'm Peter Busby, a communications manager with Public Consulting Group. I'm also joined by some members of our technical and program teams who helped develop this award program. Here on the screen right now, you can see some of the relevant Zoom controls if you're not familiar with the program. You do not have the option to unmute during the webinar. We have too many attendees for that. But please do enter any questions you have in the Q&A section. That's the easiest place for us to see them and then respond to them, or any feedback you might have in the chat. We will try our best to check there as well. But like I said, the Q&A is a little bit easier for us to use. So you can see the relevant icons on your screen right here. There will be a lot of time at the end for questions. We'll do our best to cover as many of them as we possibly can. This webinar will also be recorded. I've already started the recording. We'll post the recording and the presentation slides on the award webpage so you can review it later if you like. So everybody will get a chance to look over this later on if they want to. But thank you everyone for coming to this webinar to introduce the second round of the Access ARP Program Awards. We're very excited to support more of the great works we saw during round one. So in this webinar, we'll cover an overview of the program, including any important updates or differences from round one. So as I mentioned, I'm Peter Busby, a communications manager from Public Consulting Group, or PCG. As it says here, PCG is a public sector consulting firm that works with health, education, and human services agencies around the country. So Access is contracted with us to help administer these program awards. So part of our role is providing technical assistance to applicants throughout the application, award, and payment process. The Access ARP Program Awards are a $47.5 million program to help strengthen home and community-based services in the state. So we already had a first round that ended in July of this year, and this is now the second round. The program uses funds from the American Rescue Plan, and you can find more information on the ARP and Arizona's spending plan on the Access website. You can reach that by using the link in the presentation. The goal of the program overall is to enhance the member experience of anyone receiving home and community-based services in Arizona. The application for round two opens on December 4th. Everyone is encouraged to apply, but we wanted to note specifically that organizations that applied during round one are definitely eligible to apply again. We'll discuss that more in a moment. In terms of changes since round one, there are a few important updates. First, there's additional funding available. Access can award up to $47.5 million in project funding during this round. As a result, we were able to increase the award cap. Applicants can now request up to $1 million per project. Applicants can also submit multiple applications. You can submit 2 applications, but these must be for distinct and unrelated projects. You can't submit 2 tries for a single project. Finally, we've added another eligible activity. We'll go over all of these eligible activities later, but just for the differences, projects can now use funding to support family caregivers as well. So let's dive a little bit more deeply into those funding guidelines. So you can request between $10,000 and $1 million for programmatic or infrastructure projects. We'll explain what specific activities are eligible later on in the presentation. As I said, you can submit up to 2 applications for distinct projects. Awards will be distributed as one-time upfront funding. Admin and staffing costs cannot exceed 10% of your total request. We'll have more details about admin and staffing costs later on as well. You can use funds to create a new project or to expand an already existing one. All funds, though, must be spent by June 30th, 2025. Any unspent funds will need to be returned to Access. So here you can see a list of eligible provider types. These remain the same from round one. They are behavioral health outpatient clinics, attendant cares, integrated clinics, assisted living centers, assisted living homes, habilitation providers, community service agencies, board certified behavior analysts, adult foster care, home delivered meals, adult day health, Elderly and Physical Disability, HCBS, and area agencies on aging. Please make sure your organization is one of the eligible providers if you intend to apply. So as I said, we do encourage applicants from round one to apply again during round two. That includes both organizations whose applications were denied and those that received funding. Please note, if you did receive funding during round one, you must submit a new project for round two. So new could be something entirely unrelated to your previous project from round one, or it could be replicating that project for a new location or new members. Just note, you cannot use funds from round two to supplant funds received during round one. If you were denied funding during round one, you can certainly apply for a new project, or you can resubmit an updated and enhanced version of your project from round one. Please do not just resubmit your original application without making any improvements or changes. The result will be the same if you do so. So let's talk briefly about the projects themselves. So projects can benefit both Arizona long-term care system members and non-members. So that includes people who are elderly, individuals with disabilities, individuals living with a serious mental illness designation, and children with behavioral health needs. Awards can only go to support people living in Arizona. That does include people living on tribal land. Likewise, funding can only be used to support people in Medicaid eligible programs. Non-Medicaid clients in such programs can benefit if that program mostly supports Medicaid clients. So in other words, you certainly don't have to exclude non-Medicaid clients from participating in your program or using any new equipment or facilities, but the majority of funding should go to support Medicaid clients. So interested applicants should apply online using Grants Connect. That's our online application platform. The application opens on December 4th and closes at 5 p.m. on January 15th. So we gave you a lot of time because it goes across the holidays, but please do remember that deadline date. As I said, you may submit up to 2 applications. You cannot make any changes to those applications after you've submitted them. The only exception to that is if there is an issue with your application, some field wasn't filled in right, something like that. In that case, you may submit an updated version. PCG will notify you of such errors. Access and PCG will host a second webinar on December 7th at 12 p.m., reviewing the application in more detail. You can find the link to register for it in the presentation, or you can also find it on the program award webpage. So you can always go there to sign up. So now we'll turn to eligible activities for this award program. As it says here, any activities that improve the experience, health, or safety of people receiving home and community-based services in Arizona are eligible. So that includes any activities that do the following: increase engagement in community activities, expand supportive employment and employment skills development, including volunteerism, support member voice and their choice to lead self-directed lives, expand opportunities for social engagement and relationship building, support recreation and health promotion programs that promote physical activity and nutrition, provide support to family caregivers, expand technology that improves connectivity and telehealth, create environmental or physical plant upgrades that promote health and safety, increase or build transportation capacity, provide access to assistive technology or service animals to support independence, enhance data systems and infrastructure to streamline service delivery, promote access to care, or support care coordination, expand and enhance independent housing opportunities. So those are the eligible projects. Like I said, you can apply for either programmatic projects or infrastructure projects. Programmatic projects create or expand programs, services, or activities. These programs should support community participation, self-advocacy, relationship building, or promote better health. Infrastructure projects involve purchasing or improving any of the following. That could be equipment, connectivity access, data systems, assistive technology, vehicles, or physical plant modifications. These improvements must directly impact member experience, health, or safety. Please note as well, you cannot use funds to purchase structures like new buildings or homes. I should have mentioned that on the previous slide. But here you can see just a few examples of awarded projects from round one. These aren't meant to be exhaustive. You saw that long list of activities we had. These are just to provide some sort of, brief inspiration, something you might want to think about. So for example, Heritage at Carefree and Assisted Living Center, they proposed an infrastructure project to use their award funds to reconfigure spaces for greater recreation and enhance independence of residents. On the other hand, Kids Individual Development Services created a digital infrastructure project to support advocacy and resource identification among parents and care providers. Focus Employment Services created a new collaborative project teaching essential technology and digital life skills. And finally, Next Steps Southwest, a behavioral health clinic, expanded functional spaces to build community through peer play. So again, as I said, these examples aren't meant to be definitive. These are just a small subset of the awards from round one. You can see from the list of our eligible activities that this grant is meant to support a diverse group of projects, but hopefully these examples just give you a small idea of what might be possible in your application. We've also included some data from round one here, just to give you an idea of the diverse set of providers and projects that were funded during round one. You can also find this dashboard on the award webpage. So you can see we distributed awards throughout the state to every eligible provider type and for both infrastructure and programmatic projects. So there's a lot of flexibility in what you could potentially use this funding for. You can also see in these graphs that people applied for and received funding for projects of all different sizes. So we encourage you, if you need that full $1 million, please do request it, provided your project needs that level of funding. But also at the same time, don't feel like this award is only for large projects. We'll support any projects, throughout that funding range. So we've spoken about eligible activities already. Let's briefly look at ineligible activities as well. So award funds cannot be used for any of the following: projects with ongoing costs or other long-term cost commitments, unless you can provide a detailed plan to ensure the project will be sustainable after funding ends. Supplanting or replacing existing state funds for Medicaid HCBS. You can use funds to supplement, enhance, or expand existing services, but you cannot use it to supplant funds. You also cannot use it to supplant any funds awarded during round one. As I said, if you were awarded funding in round one, you must apply for a new project. So partnerships, you may partner with other organizations as part of your project. In that case, only the lead applicant would apply on behalf of the entire partnership. So it's not as if everybody needs to send in one together. You'll then attach letters of support from other partners to the application. So I mentioned admin and staffing costs earlier. This is a point of emphasis coming out of round one. So we wanted to make sure everyone was clear on these guidelines. So admin and staffing costs are those incurred to manage the ARP program award. They can include any of the following: salaries, supplies, equipment costs, fringe benefits, marketing costs, other indirect costs, wages, travel, or training. So please do keep in mind that no more of 10% of your project budget can be allocated to admin and staffing costs. Excuse me. So now we'll take a look at the application itself. So we'll start with the sections you'll complete in Grants Connect. So there are 6 in total. The first is organization and experience. This covers information about your organization, including your programs and service area, key personnel, and their role in your proposed project, and a communications or marketing strategy to promote your project to people who could benefit from it. Next is the project overview. Excuse me, that communications and marketing strategy is actually under the project overview. Same thing, promote it to people who can use it. But as I said, it's in this section, not the previous one. I apologize. So next is project overview. Here you'll provide a short description of your project and indicate which of the award goals it will achieve and the needs it addresses. You'll also list any key milestones and deliverables, how your project fits with your organization's larger strategy, any potential risks and how you will address them, and as I said, that communications and marketing plan. Section 3 is your project impact. Here you'll provide more detail on the people and areas that will benefit from your project. There's also space to list any organizations you'll partner with on your project, if applicable in your particular case. Section 4 covers your budget. You'll provide a detailed description of all your project costs, including projected start and end dates and total costs for any milestone, phase, or deliverable. Section 4 also includes space for you to provide a sustainability plan for how you'll continue this project after funding ends. Section 5 is your project timeline. You can provide any additional details on the milestones and deliverables you laid out in the project overview and budget, and list the start and end dates for your overall project. Section 6 covers reporting outcomes. Here you'll explain the target outcomes for your project that you'll be responsible for reporting on. You'll also explain your method for collecting and measuring data related to these outcomes. So speaking of reporting, we'll just review the reporting requirements for awardees quickly. So applicants who receive awards are responsible for submitting quarterly reports to Access. You'll identify your target outcomes for reporting from among the following list. That could be employment and volunteerism, community integration, self-advocacy, family caregiver support, relationship building, health promotion, or technology access. All documents, awardees must retain all documents related to their project for at least 10 years. So here, just in a nutshell, are the important dates you need to be aware of to apply. So I already mentioned the application open date and the second webinar. Please note, we'll also have open office hours on January 8th. I'll talk more about them in just a moment. You can also see the expected timeline for award decisions and notifications here. Finally, as I mentioned earlier, all awarded funds must be spent by June 2025. So please do keep that in mind as you're devising your project. So speaking of that December 7th webinar, as I said, that webinar will cover the application in more detail. During that webinar, we will walk through how to create a Grants Connect account, what's included in the application, new and updated questions from round 1, and examples of high quality responses from round 1. We'll also go through the full application together so you know exactly how to fill it out. You can register for that on the award webpage. I'll also make sure we add this link in the chat so everyone has it. As I said, we'll also have open office hours on January 8th. We'll send out a reminder email with a link when we get closer to that date. You don't need to register in advance. These are just open office hours. You can join at any time within that 12 to 1 p.m. range. These office hours are completely optional. This is just a chance for you to get any last minute questions answered before you submit your application. So we'll just finish here with some tips for the second round. These are things based on what we saw in round 1 that we just like people to keep in mind as they apply. So please do confirm your provider type to ensure you are eligible before you go through the trouble of completing that application. The list you saw earlier, it's also on that program webpage. Likewise, make sure you're using an eligible Medicaid ID when applying. you will need to submit that as part of your application. So as I said earlier, admin and staffing costs were a particular sticking point for some round one applications. So please do make sure you understand those guidelines when creating your budget. As part of that budget too, make sure you provide sufficient detail and justifications for your different milestones. Excuse me. And please be mindful of the scope of your project. You do not want to add unrelated activities in the hopes that that will enhance your score. It won't, and it could even have the opposite effect. So please do make sure your scope reflects the impact and activities of your project. So just a couple more tips. Only include funding for activities to be completed during the grant period. So as I say, nothing from before the award or after that June 2025 date. So that's when all funds must be expended. In your application, make sure you provide a clear plan for sustainability. This is true for everyone, but it is especially important if your project has any of those ongoing costs. Finally, for anyone whose project was denied funding in round one, please do not just submit the same project. Make sure you update it to address any weaknesses when you reapply. So as I said at the beginning, part of PCG's role is to provide technical assistance to applicants throughout this process. We've set up a few ways you can get answers to your questions. If you have any questions, your first stop should always be the program webpage. You can find that on the Access website. There you can find FAQs and a guide to using Grants Connect that should be able to answer most of your questions. We will update that FAQ periodically to address any new questions we receive that we feel everyone would benefit from having the answers to. Excuse me. After both webinars, we'll also add recordings of the presentations to the webpage. So we'll make sure everybody, if you need a copy of the presentation, just go to the program website. You can find both this PowerPoint and the recording of the webinar. It won't be up immediately. It takes us a little while to get it up there, but you will be able to find that on there. If your question is not covered by the FAQ or the Grants Connect guide, please do reach out to us directly. You can call or email us using the contact information here. Whichever one you prefer is fine. So at this point, I will open things up to questions. I see we've already gotten a bunch. We will run through those. Please do keep submitting them. We have a lot of time. So obviously we have a lot of, we have a lot of attendees here today. So we'll do the best we can to answer as many questions as possible. So please add any questions to the Q&A if you haven't already, and we will read it out or answer it there. If you added them in the chat, we will do our best to go through those. But as I said, the Q&A makes it a lot easier for us to see them and to make sure your question get answered. So I will open it up now. What questions do you have? We have an hour left, so we should be able to get through a whole bunch of them. And I will just go back. I think we all understand the way the question process works. So for now, I'll just go back to that technical assistance page so y'all can take down that email or the phone number if you need it. It's also on the grant website. So we will just start at the top of the Q&A and sort of work our way down, and we'll bounce between the webinar and the chat and the Q&A as we go. So first question, if they can use award money to perform any facility inspections. So Danielle, I will open this up to you to start. Would facility inspections be considered an eligible activity under this grant program?
This one, I'm going to have to check and we'll have to answer in the FAQ because I'm not 100%.
Okay, understood. So like I said, we'll make sure we post any answers to that FAQ and we'll get it done as quickly as possible so y'all have time before you develop your projects. But Michael, you'll get an answer there. And then Danielle, sort of similar question for you, or I don't know if we cover this in the FAQ. How would they confirm that they're a licensed provider eligible under this grant program?
This information is in the FAQ now that's on the website. but you would essentially work with our provider enrollment department to make sure you're a registered provider and what your provider type is. So again, you can find more information, including the how to contact provider enrollment in our FAQ on the website.
Thank you. Lisa, I see your question about awards from round one. I believe I answered it, but I will reiterate. If you were awarded in round one, you can expand on your original project, provided it, provide services in a new location or a new group. You just need to be very clear how this is new and not supplanting the funding you received in your original project. Okay, would adding additional day treatment programs or employment services for DDD members be an allowable expense? Danielle, do you know what DDD members would be?
Yeah, that's one of our health plans. That does sound allowable to me. You can definitely try to expand your services. Again, there's more information in the FAQs and on our website. But I would definitely look into submitting an application.
Thank you. So Diane, you asked if previous applicants will be given details regarding why their initial applications were denied. We're not going to let everybody know why they were denied. We received far too many applications to do that. Our hope is when we go through this webinar and the second one, that it'll be clear why yours was denied. If you have more specific questions on your particular application, please do reach out using the helpline here, and we'll try to give you an answer as best we can within the strictures of the process we have. So Danielle, another question about eligibility. Is paid training included as an eligible activity or cost for staff members?
I think we'd really have to see your application to make that determination. So I would encourage you to go to the website, look at the eligibility criteria, and see where your project would fit in.
I think the same thing would apply, Yvonne, to your question. Excuse me. If part of the funds could be used for staff training. Again, it would depend on the project, and it would depend how that fit into those admin and staffing questions. So this would probably be a more specific question we'd have to address either through the helpline or as part of your application review. Can one grant cover a combined programmatic and infrastructure project? Yes, you can absolutely do both. So you can do programmatic, infrastructure, or a combination of the two. That's definitely allowable. Did you say you can purchase land or buildings with these funds? No, I said the opposite, actually. You cannot use these funds to purchase structures. Again, you can see a full list of the eligible and ineligible activities in the FAQ or on the program webpage. Is there a list of awardees and projects awarded in round one? Danielle or Monica, you may be more familiar with this. Do you remember from the dashboard if it has a list of awarded projects?
We have some information. We don't have a list of the actual awardees, but there is more information on the types of projects that were awarded on our website.
Okay, I think that takes care of the next question as well. I'll do a few from the chat now as well. I know some people posted some there. So let me just scroll down here so I can catch up. Or if, I don't know, Sasha or Monica, if you've been monitoring the chat as well, if you know any questions while I'm scrolling. Okay, so here, can we apply for expansion of part one? Again, I think I've answered this. It must be a new project or an addition to your other ones. So here's a question from Maybell. What proof is needed to give confirmation that services we provide are on the Navajo Nation? So I guess this question is mostly about geography. How do they prove they're providing services to Arizona residents?
Peter, this is Monica. I don't believe that there is a need for an actual proof in terms of documentation, but in the section 3 of the application, where it goes into the project impact, it will ask which counties do you serve and which tribal nation. So that will kind of capture that piece.
Thank you. Thank you, Monica. Question about, is NEMT included? Danielle, I'll have to defer to you again. Here's another acronym I'm unfamiliar with, unfortunately.
You can apply for a grant to buy or build up your transportation, so purchasing vehicles. NEMT is already a service we provide, so you would have to bill for that as normal. That would not be included as part of the grant.
Okay, we've covered most of these. Got that. Okay, so is partial funding available? If they ask for $1 million and let's say they don't get awarded all of it, will they be awarded partial funding?
No, I don't believe so. The application will be reviewed as a one project. Everything will be evaluated together, and if you're not awarded, it's the whole project.
Michael Barry, you asked me to explain what I mean by long-term. Within the context of this project, long-term related to those cost commitments would be things that go beyond that June 2025 end date. So all funds need to be expended by then. So if you have a project that will have ongoing cost commitments beyond that, we need to know what your sustainability plan is for covering those costs. We just want to make sure that come, June 2025, your program, let's say, doesn't just, end immediately. Is there a grant writer available to assist? No, we do not have a grant writer available. Actually, I don't think that's a question for us. I apologize, but I answered it anyway. Partial funding. Yes, you will get a copy of the PowerPoint. Okay, we've done a few from the chat. I will bounce back for now from the Q&A and sort of just work our way through it that way. So does not purchasing a new building mean you won't fund the construction cost of a new building project? If not, perhaps we can ask for the equipment, assistive technology needed within the building. So I can answer the second half. You can definitely ask for equipment or assistive technology needed within the new building. For the first half, I think it would depend on the specifics of what that project is. As we said, you can't purchase any new structures, but if this is an enhancement to an existing, place area within your building, that might be eligible depending on the project. Danielle, do you have anything to add there?
No, I think you captured that perfectly.
Thank you. Does equipment cost include if our whole project is for equipment to enhance our infrastructure? Again, I think it would depend on what the project and the equipment was. As I said, equipment is definitely an available expense, but that equipment has to enhance the safety outcomes, health of your Medicaid clients. So long as you can articulate that and how that equipment will support that effort, it would most likely be eligible. Okay, a couple of these we've answered already. So Monica, I think this is a question about Grants Connect specifically. So Ryan asks, are the deliverables they list in the application part 2 going to become the line items in our budget?
Yes. And Sasha can also speak to this, but I believe that the application is set up so that whatever you put in your milestones up in the project overview will directly match the milestones you for the budget. Correct, Sasha?
Yes, that's correct.
Okay, another question. Danielle, I'll have to rely on you for this one. Are health information exchange projects appropriate costs if you aren't getting DAP funds for them already?
I think that might be appropriate. We would definitely just need to see your application to determine for sure.
Is there any way just to get our score for each section of the past grant submission and total possible? So I guess the question is what's available from previous applications for them to see? Sasha, is there anything you could add to this?
What was the question? I apologize.
Basically, they want to know what data from their previous application they can access, mostly with relate to the score.
Okay. Oh, okay. So you will only be able to view your previous answers. We are not sharing individual scores.
Thank you, Sasha.
Mhm.
Okay, so are any capital expenditures ineligible for funding under the project, even if there is a plan for how to cover these costs after funding is depleted? And okay, so we'll do this in a couple of stages. There are serious questions here. So are any capital expenditures eligible for funding under the project? Danielle, if we can start there.
Sure. So I understand capital expenditures to be items like technology and equipment. In some cases, those are eligible for the grant. You have to look again on our website to get real more information on what the eligible activities are, and we would have to review your application to better understand how you plan on using them to see if it'd be an approvable expense.
Thank you, Danielle. And I will take that second half. If by operating expenses you mean those things covered under admin and staffing costs, those are eligible, but they cannot exceed 10% of your total request. If you mean something other than those, I think you would have to explain to us what you mean by operating expenses, or reach out to that helpline with something more specific, and we can tell you whether that's eligible or not. So Brittany, you asked if there's any information different between round 2 and round 1. There are a few important updates. I went over them at the beginning. So you can see them at the beginning of this presentation. If you go back and review it, you'll just say updates for round 2. They're also separated on the award webpage, again, just under updates for round 2, and in the FAQ. So you can find those in a variety of places. Okay, so an anonymous attendee was asking about the scoring criteria. So those scoring criteria are also covered in the FAQ. You'll be able to see sort of how scoring works for various sections. I don't believe that they provide the exact weight, but it will indicate what the criteria for each section are. Sasha, another question about Grants Connect. Can applicants access their original application from round 1?
Yes, applicants will be able to log in with their previous credentials, and they will see their previous application. They just won't be able to edit.
Okay, thank you. Sasha, if I can ask you to, a couple people asked for the registration link for the webinar. I don't know if you already have, but if you could just drop that in the chat too, I would appreciate it.
Okay, I will drop in the generic link, but I don't recommend, if you did not apply for the first round, we don't recommend that you go in and register, because it might create an issue once you go in to apply where you'll have to reach out to us. But
Sasha,
I will drop it in the chat.
No, I'm sorry. I meant the registration link for the second webinar.
Oh, okay, sure.
I appreciate you
No
giving
problem.
that answer anyway. It's very useful, but
Okay.
Okay, a couple more people asking about where to find the slideshow. It will be on the web page shortly. It is not yet, but it will go up there eventually. So Danielle, are agencies without an Access NID eligible?
So you do need to be a registered access provider with your provider ID, unless you are an area agency on aging, otherwise known as our AAAs. But otherwise, yes, you do have to be a registered access provider.
Thank you. And a similar question, if an organization does not accept Medicaid, they would not qualify for this particular grant. Is that correct?
That sounds correct to me. I don't believe you'd be a registered access provider if you didn't accept Medicaid.
Just still going through the chat. A lot of these have been covered already. Are public schools considered community service agencies to fund for special needs students?
So the community service agency is actually a provider type with access. I couldn't tell you off the top of my head if there's any schools registered as a community service agency, but again, you can work with our provider enrollment department, and their contact information is in the FAQ on our website if you're unsure what provider type you are.
Thank you. And then more acronyms, I apologize, I'm not familiar with. Do DTA, TTE, and GSE programs qualify?
It depends on how you're registered. So again, you'll want to work with our provider enrollment department, and their contact information is on the FAQ on our website.
Do enhanced behavioral group homes qualify under enhanced behavioral outpatient clinics?
It would again depend on how you're registered with the provider enrollment department.
Do they need to have an access provider ID number to be able to apply? So you definitely need a Medicaid ID number.
Yeah, and the Medicaid ID is the same as the access provider ID. So you do have to be an access registered provider with an active ID to apply for the grant, unless you're a AAA.
I covered a few of our other questions too. Okay, here's a question from John Luther. If we are building a large building, as part of a large capital project, but need funding for renovation, capital equipment, and usability / licensing of that building, is that an eligible project? So, John, I imagine parts of that would be, depending on the renovations and the equipment we're talking about. I'm not sure about usability and licensing. I think, Danielle, that's something we said we were going to circle back around on later. Is that correct?
Yeah, I'll have to check on the licensing. I'm not 100% on that, so I don't want to give anyone bad information.
Sure. So, John, we'll make sure we get an answer to that in the FAQ. Regarding the specifics, it sounds like some of that would be eligible, but without hearing more about the exact project, it's hard for us to say for sure. Suspended providers are not eligible. You have to have an active provider ID in order to apply. Question from Jamie Moore. Is expanding into a new group home for new members allowed? I think that would depend on what expenses were involved in expanding. We said you can't purchase buildings, but there may be some eligible expenses under that expansion. Danielle, what do you think?
Yeah, definitely. We'd have to see the full proposal, but expanding service delivery is something we want to see. So again, look at the eligible activities on the website and form your proposal for us. But expansion services should be acceptable.
Okay. And then we have somebody asking, there a wound clinic in Central Phoenix. Would they be within the services that can apply for this grant? So again, we've listed the eligible provider types. So long as your provider type is on that list, you would be eligible. And then you just have to determine what your project would be and if it covers those activities we outlined as priorities for the grant. And Alex Whittle asked for some examples of increasing or building transportation capacity. Monica, Danielle, do you remember any examples we've seen or other things that could qualify as increasing transportation capacity?
We saw quite a few of people asking for funding for wheelchair accessible vans. So that is something that was eligible. Also for community, for group homes and residential, to be able to for people to go into the community. So there was vans that were so that multiple people at once could be could move into the community and go to different places. That was another one. Danielle, do you remember any others?
No, that's about right. It was a lot of purchased vehicles
Yeah.
that were more accessible.
Yeah, for mostly for wheelchair accessible purposes.
Mhm.
Okay, so we've covered active provider types. If they're awaiting credentialing, so presumably awaiting to get an ID, would that count as having an active provider type? Would they be eligible?
I don't believe so. The active provider ID is the only type that will show in our system. So if you're on a waiting list, I think credentialing or the provider enrollment department is still working with you, to my understanding. So it does have to be an active provider ID.
And then is funding available as down payment on a loan? I don't believe that would be eligible. Danielle, please correct me if I'm wrong.
We can double check, but my gut says that would not be an eligible expense.
Okay. Okay. Is staff training an eligible project? I think we've addressed this question earlier as well. I don't remember exactly what we said though.
I think it really depends on the project
Yeah.
and the scope.
Yeah, and also we would have to see because it could also fall into the admin and staffing 10% cap. So definitely look at the FAQ and make sure that it falls under the correct category.
So Chelsea, to address your question, that might be something we need a few more details on to be clear whether or not it falls under that 10% before we can answer them for you. Okay, we already covered pending approval. Question. Oh, okay. So one attendee is asking, they weren't around when the initial round ended. They're curious how they could find out if their organization applied last year. Sasha, is there a way? I mean, presumably we would have the organization name somewhere.
Yes, they can reach out to the inbox and we can verify that for them.
Thank you. Yeah, so just shoot us an email and we can find out for you whether or not your organization applied. Covered this one during the presentation. Okay, so some people asking about clarification for Medicaid ID. So does that mean tax ID or a specific kind of ID that someone applied for? So Danielle, can we give any guidance on what exactly the Medicaid ID is?
Your Medicaid ID is also known as your Access Provider ID. That is something you receive when you register to be an access provider. You can find more information on contacting our provider enrollment department that handles this process in the FAQ on our website.
Thank you, Danielle. So a few more people asking about weaknesses in applications or sort of how they can make changes to round two. So as we said, we won't give sort of specific score information out. We're hoping that second webinar on the 7th will provide, by providing examples of high quality responses, that would show, okay, maybe here's where our response didn't quite line up. If you're still concerned after that, you could reach out to us and we can at least give you some advice on your project. We won't necessarily be able to walk through your previous application with you. That's just not something we can do. But hopefully through these sort of various methods, it should be clear to you what changes you would need to make. We already covered that one. What is the minimum amount that can be applied for? $10,000. So the range of funding available is 10,000 up to 1 million. And like I said, you can apply for up to 2 applications. So again, another person asking about eligibility, you need to have that access ID in order to apply, even if funds are going to Medicaid clients. So you need to be a registered provider to apply. So let's say we are creating an accessible gym. Would gym equipment fall under the admin costs or infrastructure? Just based on the question, I imagine that would be infrastructure. So that would be a qualified equipment cost. Uh, Admin equipment would be, things that are required to run the grant itself. So let's say you needed a new laptop for your office as a result. That would potentially be admin and staffing equipment, as opposed to gym equipment for clients to use, which would be an eligible infrastructure cost. Danielle, please correct me if I misrepresented anything there.
No, great answer.
Okay, so can funds be used for developer or architect or building permits? Or would that fall under admin costs? I think this goes back to our licensing question. Trace, we'll have to circle back. As I said, we'll make sure all these questions get answers in the FAQ, and that FAQ gets updated on the award webpage. Question on housing. Is building a low-income housing an allowed project? I imagine that would fall under the exception for purchasing buildings or land. Danielle, does that sound right to you?
Yeah, I agree. We have some safety nets in here because this grant is being provided through the ARPA dollars, and we've already used a good portion of that ARPA money for direct care worker wages and for housing assistance. So this grant is really specific to home and community-based services. So we're not trying to supplement housing through this grant.
So question about reporting requirements. So there's more information on the reporting requirements in the FAQ. You can find that there. I will say as well, the reporting requirements apply to awardees. So it's not necessarily something you need to worry about now. If you feel like the reporting requirements will be a barrier to your application, please do reach out and talk to us. I mean, that's not our intent. We want to make sure people are able to apply. The quarterly reports are mostly for us to gather accurate data on your project and just ensure, things are progressing properly, funds are being allocated as they should be. So again, if you think the quarterly report might prevent you from applying for one reason or another, please do reach out to us and we can talk through that a little bit more specifically. But if you're just looking for more information on quarterly reports, that is in the FAQ on the award webpage. Question about login. Sasha, I think this one is best for you to answer. Can they use the same login they used for round 1 to log into Grants Connect for round 2?
Yes. Yes, you can use the same account to apply for round 2.
More question about that 10% limitations. Does this essentially represent indirect costs? Would this also include personnel who are carrying out programmatic activities?
Yes.
So indirect, Monica, yeah, you have an answer.
Yeah, the short answer is yes.
Yeah, it definitely includes indirect costs. That's certainly included under it. It would also be those personnel as well. Would transitional housing for individuals with developmental disabilities be eligible? Again, that would depend on the costs we're talking about. If you're talking about purchasing housing, no, that wouldn't be an eligible expense. If you're talking about other associated expenses, maybe that's retrofitting, equipment, that sort of thing, that could potentially be eligible. It would depend on the specific project. Can funding be used to help digitize an agency, going from paperwork to an app, something along those lines? So digital infrastructure is included in the infrastructure projects. So that would potentially be eligible, but you would have to be able to articulate how that would improve the experience and safety of members. So if this is just a way to make your agency more efficient, that might be a difficult sell. If it's a way to make sure, your members are getting access to a new service, something that they were previously barred from, that might be eligible. So again, so long as you can connect it back to member experience, it could potentially be eligible. Okay, questions about eligibility. Nothing's really changed in terms of eligibility from round 1 to the second round. It's the same provider types. You still need your access ID. All that still applies. If you were awarded in round 1, I imagine that means you are eligible for round 2, unless you've lost your license or something dramatic has changed. I think that's a fair assumption. Monica, another question about staffing. We'll answer it again just in case. But it says staffing costs are limited to 10%. Is that all staff involved in the project or just admin staff? Is that a distinction we can draw?
It's all staffing. The definition of admin and staffing has now, been put together in the FAQ, so you can see the detail of what the definition of admin and staffing will cover. And all of the staffing and all of admin has to be within 10%.
Thank you, Monica. Another question about waiting for credentialing. Again, you need to have an active access ID and active Medicaid ID in order to apply. Sasha, I'll ask you, I'm not at the bottom of the chat, so I apologize if you did this already. If in addition to the webinar link, you could also just drop in the link for the award webpage. Some people are asking for that as well.
Sure, I'll do that now.
Thank you, Sasha. Danielle, a question, you'll probably be the best one to answer this. Would fees for recruiting nurses to work open DDD cases be an allowed project?
I don't even know where to begin with this one. You'd have to submit your project so we could see, but yeah, I'm not sure exactly what the project would be here that would benefit or fall within the eligibility criteria.
Whoever submitted that anonymous question, please do reach out to that helpline. You still see that email on the screen. If you give us some more specifics, we can try to give you a better answer. The new limit is $1 million per project, not per organization. So you could submit 2 applications requesting $1 million for each, and both those applications would be potentially eligible. We answered that one already. We covered this one too. Another person asking about programmatic or infrastructure projects. Again, we talked about it could be programmatic or an infrastructure project or both. We've gone over what those categories are. There's also information in the FAQ. All right. Are adult behavioral health therapeutic homes provider type A5 eligible? Is provider type A5 considered the same as provider type A50 under this program? Danielle, I think that one would be you too.
Provider type A5 and provider type 50. I don't believe we have an A50. They're 2 different provider types. If you're not sure about your provider type, again, we have provider enrollment information in the FAQ on the website.
Thank you. Do you have to be contracted with access to apply? So you definitely need an access provider ID. I don't know if that means you're explicitly contracted with access, Danielle.
Yeah, contracted means something different to me. So you have to be a registered access provider or an area agency on aging. You don't necessarily have to be contracted with us directly. You can contract with one of our health plans, but you still have to be registered with access as a provider.
We are a small 10-bed behavioral health residential facility looking to expand, and we need a transportation vehicle for our residents' outdoor activities. Are we qualified to apply for this fund? So I think there's a few questions here. Are behavioral health residential facilities qualified providers? We'll start there. I don't have the page in front of me. I apologize. Danielle, do you remember?
I don't believe behavioral health residential facilities are a qualified provider type. You can go to our website and double check and contact provider enrollment if you're not sure what your provider type is. So that's where I would start.
And then I'll just answer the second half of the question. Regardless, would a transportation vehicle be an eligible expense? It is an eligible infrastructure project. Again, you would have to explain how it aligns with all the goals of the grant in your application itself. Do individuals with disabilities include children? I imagine this is a question about who would be eligible to participate in programs. I think certainly children with disabilities would be a relevant audience. Question, how can an organization enroll as a provider with access? Danielle, is there a short answer we can give here?
I would recommend, again, going to our website and looking at provider enrollment's contact information, because you'll have to work with them directly.
Thank you. A recording of the December 7th webinar will also be available on the webpage. We've talked about vehicle improvements. Those are an eligible expense under infrastructure, again, provided you can link them to the goals and activities of the grant. Okay, question about eligible projects. Again, you cannot use funds to buy land or housings, dwellings, that sort of thing. You can use it to make improvements or enhancements to existing structures to fulfill the goals and activities of the grant. Would puppy companion programs qualify? Danielle, do you?
I think you could fit that into the eligible activities. So again, just go out to the website and figure out how that would fit into the eligible activities, but we'd have to see your grant proposal to make the final determination.
Thank you. A few more people asking about infrastructure, building improvements. I feel like I've already answered that. But one part of this question, can the grant be used to support facility improvements on a rental property? I don't know how rental property applies there, Danielle.
I'm not sure either. That may be one we need to get back, because I don't want to give any bad information.
Okay, so we'll make sure we get an answer to that in the FAQ. So more questions about round 1 to round 2. Excuse me. So again, you can apply for an additional $1 million as part of round 2 alone. So that's the cap for your round 2 project. So if you already received, let's say, $100,000 in round 1, that has no bearing on how much funding you can receive in round 2, at least in terms of the individual project cap. Would cost of living in a sober house qualify? I'm not sure exactly. I guess the question is providing people stipends to cover their housing.
I'm not sure if that would be an eligible project, but again, look at the eligible activities on our website and see if you can determine how it would fit into what we want to fund with the grant.
And also, that seems like a project that goes beyond the grant period. So just also make sure that the funding you have to spend all your funding by June 2025. So something like this may be affected by that limit.
Thank you, Monica. So somebody asking about submitting applications, if those 2 applications will compete with each other, or can they receive funding for 2 awards? So your applications will not necessarily compete with each other. It's not as if you receive one, your other one gets deleted, or we'll only pick one of the 2. That being said, Access does reserve the right to prioritize organizations that haven't yet received an award. So if you've already received 1 award as part of round 2, Access may prioritize other equally deserving applications for an award before they circle back and award your second one. So they're not necessarily competing with each other, but it is the case that Access may prioritize organizations that haven't received an award yet.
And all applications will be reviewed.
Yes.
So it's not competition, it'll be like separately reviewed.
Thank you, Monica. That's a good point as well. Would funds cover for a startup ABA facility? Danielle, I'm not sure what an ABA facility is.
Again, you'd have to look at the eligible activities and submit your application if you feel it meets that criteria.
Thank you, Danielle. Is the grant specifically for the state of Arizona? Yes, it needs to serve, well, an organization needs to be in Arizona, and it also needs to serve residents of Arizona. Okay, answer that one. Answer that one. Are health information exchange projects appropriate costs if you aren't getting DAP funds for them already? So this sounds like another digital infrastructure question, in which case the answer would be the same. It needs to relate to the health, safety, and experience of actual members. Danielle, anything you can add there if I'm misinterpreting this?
No, not at all. Yeah, as long as you can relay how it improves member experience in your application, we can definitely take a look at it.
Thank you. Can multiple facilities apply for each facility? So I know there's guidelines for this in the FAQ. Monica or Danielle, do you remember offhand what the answer was?
So if it's one project that will impact a lot of like several facilities that you all have, just submit that one application.
Thank you. Thank you, Monica. Yes, and as I said, I know I'm sure Monica's answer is correct. There's some language in the FAQ
Yes.
as well. So you can
We
also
touched
check
on this for round one. So if the webinars from May from round one are also available, and so I think there's a conversation about this in that webinar as well.
I see it here as well, Monica. You already answered that question in the chat, so thank you as well. Most of these we've answered already. A few people asking questions about who received grants during round one. Again, that information is on the award webpage. You can see that dashboard, provide some information on which organizations, or I should say, which types of organizations received awards. Digitize an agency, we answered that. These funds can be granted to new projects with no prior project history. Yes, you can definitely apply for a new project. As I said, you can also apply for an expansion of an existing project. You just need to be clear on how grant funds will enhance your existing project as opposed to supplanting already existing funds, either from round one or, excuse me, another funding source. Okay, we already answered whether the access number is the same as the Medicaid ID number. We've covered that. Monica or Sasha, here's a question I think about Grants Connect. Do applicants select only one or more than one of the target outcomes listed on the reporting slide?
You can
sure.
select, oh, sorry.
Go ahead, Monica.
You can select as many as you would like, as long as you will actually, it's selecting more will not help your application. I would only select the ones that you're actually going to measure, the outcomes that you're actually going to measure, because those are the ones that you will have to report on. But the application has the availability for you to select more than one.
Danielle, this is a question about access. Probably the best to answer it. Is the freeze over for new access providers to apply for an access ID number?
I have very limited knowledge on this, but I believe the freeze is just specific to certain provider types. And I don't know what's ongoing with it right now. You can look online to see if we have any more information. I believe that information would be under our Office of the Inspector General.
Thank you, Danielle. So another question about newly licensed providers. Again, it's fine if you're a newly licensed provider, but you need to have an active access ID. So if you're still waiting on that. You need to have the ID in order to apply. And it should be said, you have until January 15th. So the application opens on the 4th. If you don't have an ID then, but you do, let's say by December 20th, you're still eligible to apply. If in round one, they were awarded for an infrastructure expansion, can they apply to expand even further? So additional funds needed for a larger expansion. Rose, I believe this would be eligible just based on your question. Again, if you want to apply for round two, it has to be a new project or a new expansion of your previous one. So it sounds like in this case it would be. Again, we might need some more specifics to decide exactly. Monica.
Yeah, just be very specific about what is different from the first application to the second application.
Would labor to build an expansion be considered a 10% admin or staffing cost? I don't believe so, but it's hard to tell the specifics just based on the question.
Yeah, you would have to submit the application and the reviewer will, depending on how you outline it, it would be evaluated.
Thank you, Monica. Danielle, I'm having trouble understanding this question. Maybe it would make more sense to you. What is the criteria for integrated care?
Oh, I'm not entirely sure what is being asked here either. I'd recommend you go to the Access website. You might be able to find more information there.
And Daniel, Marco too, as I said, you can always email that helpline. If you give us a little bit more specifics about your question, we'll make sure we do our best to get you an answer. Okay, we already answered this one. Answer this one. This one. Can funding be used for construction of housing if the housing is owned by CSA? So Danielle, I don't know if that CSA bit is changing anything here.
I don't believe it is. I'm sorry, I'm unfamiliar with CSA, but we are not using these grant funds for housing. We've used other grant funds for housing, just to make that clear.
Thank you. Diana asks, can funds be used to renovate an existing structure for better living conditions of members? Yes, that sounds like that would be an infrastructure improvement. And as you put it in your question, provided you can say how this benefits members, that should be an eligible expense. To what you just said about a proposal for both infrastructure and programmatic projects, can we include more than one project on an application? No, your application has to be for a single project. When I said it could be both, what I meant is, like, let's say I wouldn't want to attest that this would be completely eligible. Let's say if you're building a new gym facility or enhancing a gym facility for members, and as part of that, you're going to have both new equipment and classes for members to take. That would be both a programmatic and an infrastructure project, but it would be a single project, right? It would be that new fitness center you're enhancing. If you have more than one project, like I said, you can apply for 2 applications as part of round 2. So my advice would be to just do them as part of separate applications. Would the cost for training and tuition for low-income, entry-level healthcare workers be an eligible workforce development project? Danielle, you can jump in here.
So we're not really funding workforce development through this grant. We had, through ARPA funds, lots of other workforce development focused funds. Yeah, my gut is no, but you can always look at the eligible activities to see how it can fit in there and submit your application.
Thank you. A couple questions about when you can start the application. The application opens on December 4th. That December 7th date is the webinar. So if you think, I don't need any help in this webinar, I'm ready on December 5th, feel free to submit it. I would encourage you to wait for that webinar. What's the downside of waiting an extra 3 days just to see if it gives you any extra information? The application will be available on the grant webpage. when it opens on December 4th. We will also send out an email to everybody with that link. So you cannot access it now, but once it's open, you will be able to do so. And you can use the same login you used from round 1 as part of round 2. Okay. Service expansion to include new populations would be eligible. That would qualify as a new project if you're awarded funding in round 1, or if you just didn't apply in round 1 and you wanted to apply at round 2, that would still be an eligible project, provided it doesn't include any of the ineligible expenses we articulated throughout the presentation. So, individual asking if they can apply if they're newly licensed in Arizona. Yes, again, provided you are licensed in Arizona and you are one of the eligible provider types, you are eligible to apply for this award program. Can the grant be used to buy cars to assist access members in rural Arizona? So this would seem to be a vehicle-based infrastructure project. It sounds at first glance like it would be eligible, but again, it might depend on the specifics of the program you're describing. So Dan, initially I would say yes, but pending more details about your project, that could change. A question about how to track down your provider type. We include instructions in the FAQ on how to do that. If you follow those instructions and you're not able to track down your provider type, please do reach out to us. We will do our best to assist you. Question asking about how awards are distributed. So there's $47.5 million available. You can request up to $1 million. So if we have 47 $1 million projects, that would use most of the funding. As you saw in that bar graph earlier, that doesn't mean everybody applies for $1 million. That also doesn't mean we award every application for a $1 million project. So there's a lot of room for different types of awards of different sizes. So again, we encourage everybody to apply regardless of the scope of their project. Okay, we already talked about links for the grant. Talked about the freeze. Is rehabbing group home bathrooms to be ADA compliant eligible? So again, it seems like that would be an eligible project based on infrastructure enhancements. It would depend on
You
your
would have
provider
to,
type.
sorry, Peter.
Yeah, Monica, please.
You would have to explain how this is not supplanting existing, because the existing funds that Medicaid provides could potentially fund this. So as long as you can explain how this is not a supplanting project, then yeah.
Thank you, Monica. Are programs targeting smaller number of access clients being considered, or do these projects need to impact large groups of members? No, as we said, projects of any size are eligible. You can request between $10,000 and $1 million. So again, if the scope of your project fits those parameters, we'd be more than happy to review it, and we hope you'll apply. If a project included an outside contractor, does the 10% limit on staffing and admin include these temporary workers? Monica, my guess there would be yes. I don't think it would make a difference that they're temp workers. Please correct me.
Yeah, I don't think so. Just again, please look at the definition of admin and staffing that is provided in the FAQ, and then make your decision based on that.
Thank you, Monica. Another question about eligibility. You are eligible if you applied in round 1 or if you did not. Either way, we hope you will apply again or for the first time as part of round 2. As part of our project, may we add the cost to wrap our transport shuttles as they are in need of a refresh? Reese, that sounds ineligible to me. I'm not sure how vehicle wraps would, enhance the safety experience or health of your members. If I'm wrong and you can find a way to articulate that, please let us know. But it seems to me like that would be an ineligible project. Uh, Danielle, a question. I don't know if you have the specifics for this one. If a tribe applies, can their tribal organization apply too? Or can a tribe submit 2 applications? I can confirm at least the second half. A tribe can submit 2 applications. Any organization can, but I'm not sure about the first half.
I'm not quite sure what's being asked either. You do have to be a registered access provider. So if you are a tribal provider, that's no problem at all. Just make sure you're one of the eligible provider types listed on our website.
Thank you. Another question, Danielle, while you're unmuted. I apologize, I waited too long. But they have a question. If they are an access provider, but they have a new building that is in the process of getting licensed, can they apply for this facility? So the provider would seem to be eligible. I'm not sure what they mean by facility licensing.
It sounds like these would be eligible activities for the new setting if you're expanding services. Again, you have to look at our website, make sure it's one of the eligible activities, and submit your application. We need a little bit more details to confirm.
Sure. Can applicants partner with agencies that are not eligible providers on the list? I would say yes, provided your lead applicant is an eligible provider. I don't think all your partners would need to be. Danielle, please correct me if I'm wrong.
Correct. I don't have any heartburn about that as long as somebody is an eligible provider type and is taking the lead on the grant activities.
Thank you.
But I just want to add, Peter, it is very important that if you are partnering, that you submit letters of support from that partner. We need to know that that partner is aware that they're a partner. We need to make sure that they have confirmed that everything in the application is okay with them as well. So we do check that if you select that you will be partnering with an organization, that organization has provided you with a letter of support for the project.
Thank you, Monica. Question from Ryan. Would the review of a round 2 application that replicates a successful round 1 application, but obviously new, be expedited in any way, or does it go through the same review process? No, it will not be expedited. As Monica said earlier, every application goes through the review process, so we make sure everyone gets read. But as I did mention, the only difference might be that Access reserves the right to prioritize organizations that have not yet received an award. So again, the awards don't affect each other. Round 1 doesn't affect round 2 in terms of funding. That's the only thing that might come into play, is if at some point Access needs to decide between an application from an organization that has received an award and one that has not, both equally deserving. Are home care attendant agencies okay to apply? Provided they're one of those eligible provider types, they would be. Danielle, do you know if that would be an eligible provider type?
I'm looking at the list now, and I'm not 100% sure on what actual provider type that is. So again, look at the list we have on the website to see if you're an eligible provider. If you're not sure, in the FAQ on the website, you can find information on how to confirm your provider type.
A question from Corey. So our new eligible activity isn't caregivers to support families. It's support to family caregivers. So it wouldn't necessarily be paying for a caregiver. It could be something else like a respite program or training. I'm not sure exactly what, but it's not caregivers for families. It's support for family caregivers. Does this grant apply for the entire state of Arizona or a specific region? It is for the entire state. Doesn't matter where within Arizona you provide services, so long as it's in Arizona. If AAA subcontracts with us for our services through Medicaid, do we qualify? Danielle, would you know this?
The AAA would need to take the lead on the application.
Thank you. If we are building a large building as part of a large capital project, but need funding for interior renovation, capital equipment, and usability / licensing of that building, is that an eligible project? So this covers a few things. One, usability and licensing. Again, that's something we're going to circle back around on. We don't have an exact answer just yet, so check the FAQ for that. For interior renovation and equipment, that could potentially be eligible, again, provided you articulate how it fulfills the goals and activities of the award program. Again, so you couldn't use it to build the building or purchase the building, but some of these other projects may be eligible if they fit the criteria for the award program. Another question about funding. So yes, you can submit 2 applications for up to $1 million each. So you don't need to have them combined for $1 million. Will there be a round 3? I think no. This stops at round 2. Danielle, again, please correct me if I'm wrong about that one.
No, I don't see a round 3. I don't know how we would accommodate that within the time frame for ARPA funds.
Thank you. If there is a metal cover for a horse arena to keep it in shade year round, would this be acceptable to use for infrastructure funding? I guess it would depend what the horses are used for. If that would support member experience somehow, it could potentially be an infrastructure improvement. But again, you'd have to articulate clearly in your application how that's going to help your Medicaid clients or members. Okay, that brings us to 1:30. I apologize. I know we still have a lot of open questions, but we had over 600 people attend this webinar and it just wasn't possible for us to get to all the questions. So hopefully in answering the ones we did, we hit some of your questions as well. I will say again, if your question was not answered and you need help, please do check that FAQ in the program webpage. That should be your first place to check for answers. And if you don't see anything there, feel free to reach out to us through that email or the phone line. The application opens December 4th. We have that additional webinar on December 7th and an open office hours January 8th, which you can also get additional help. As we said, we hope everyone here will apply, and we're excited to review another set of projects. Danielle, any last words you'd like to add before we sign off for today?
I just want to remind everyone again, we'll be going over what we saw in the first round in a little bit more detail to help you fill out your applications for round 2. And again, that is December 7th. So please register and attend.
Thank you, Danielle. So with that, we will end things. Thank you everyone for attending. And as I said, we look forward to reviewing your application.
Thank you.